Welcome everyone to our third budget hearing for the Sioux Falls City Council for the 2017 budget of Sioux Falls. Mark, I hope you're okay over there all by yourself. And we really do like you. You don't have to sit there all by yourself, but that's okay. Thank you again for being here, everyone. Let's get started with Public Health. Jill Franken, Director Franken. Welcome, Counselor.
Good afternoon. Jill Franken, Public Health Director with the City of Sioux Falls. As we get started here with our budget for public health, I want to thank Amy Richardson and Tim Conda for all the work they did in getting us prepared for this presentation today and all the work they've done in preparing for the 2017 budget, as well as Alicia Klura and the management team who helped to identify and quantify the operational needs that we will have in 2017. So our health department budget, totaling $12.3 million for 2017, assures the health department is equipped to carry out our mission, and that is to mitigate adverse health conditions and threats, to provide services aimed at controlling and reducing disease in our community, as well as providing an open door to medical care, primary care through Falls Community Health. So through our public health preparedness and prevention areas of the work that we provide to the community, a variety of services and programs you can see here are provided and to our constituency, to our public. Some notables that I would mention from 2015 are that Live Well Sioux Falls in this category, in this section of our budget, was one of the significant project committee members to work through the Complete Streets policy that was approved in 2015. We've also had continued progress in exceeding our goal of achieving voluntary compliance with nuisance cases, our neighborhood nuisance control program, and improving the efficiency of that nuisance case management. We also in 2015 had a successful transition of our ambulance service contract. And I'll mention that we mitigated a potential threat of a measles outbreak early in 2015. We contained that to a single case. So the health department has specific goals that we achieve, and we have that both on the public health prevention side, preparedness and prevention, as well as on our clinical services side. Here's just a couple of examples of those that we try and achieve and work towards on the public health through mitigating adverse health conditions and threats. You can see these two goals, and then the check marks indicate what our actual performance was in 2015. So then on the clinical side, through the work of Falls Community Health, we provide the community an open door, as I said before, to healthcare services. Some notables within the services that are listed here are that in 2015 we became approved to be able to receive malpractice coverage through the Federal Tort Claims Act. This was a significant amount of work to be able to be deemed for this coverage, and we believe it has an estimated savings of tens of thousands of dollars in the coming years to our department. We also upgraded our medical coding. We, along with all the other medical services across the country, updated our coding to the ICD-10, which took us from 13,000 to 68,000 coding choices in our department. No small feat, but one that was very efficiently completed in our department. We had a really successful provider recruitment again in 2015. We hired a dentist, Dr. Liz Neighbor, to join our dental team. And then we also hired Leah Mergen, one of our advanced practice providers. We also remodeled our medical clinic reception area. We received some quality grant dollars to be able to do some work to make our area where we receive patients and do their patient education and work with them on setting up their next appointments in a more effective manner and being more patient-centered in the process. And then it was our clinical staff who actually did the heavy lifting during that measles case by providing immunization services, emergent immunization services, MMRs, to people in our community who needed them during that time period. So on the clinical side, we have a number of measures that we have to comply with from our various payers as well as our grantees or grantors for assuring that we provide quality care to our patients that we serve. These three listed here are just three examples of many that we have to comply with. Some additional examples of quality measures that we have to monitor are cervical cancer and colorectal cancer screening rates, childhood immunization rates, our rates of screening for substance abuse and depression with our patients, patient tobacco use, as well as our ability to do counseling towards cessation with those patients, as well as dental treatment plan completion rates. We benchmark all of these against both state and national community health centers to assure our performance is able to and work towards, and if not also exceed, meeting those state and national benchmarks. So our budget overview. Our operating budget for 2017 is recommended at $12.2 million. Capital is rounded up to 0.1, investing $12.3 million in public health for Sioux Falls. So let's talk about the revenue side first. The health department generates significant revenue to support the services that we provide. For 2017, those estimated sources of revenue include 43% of that, or $5.3 million of revenue, is generated by the health department through charges for services. So licensing, permitting, registration fees are some of those ways we generate revenue, but we also generate significant revenue through Medicaid, Medicare, insurance, and patient fees for the services on the clinical side. We have significant grants and governmental contracts that we receive, and that's 28% of our revenues, or $3.4 million. Those would be those federal, state, and local grant awards, as well as contracts such as from like the State Department of Health. 7% or $860,000 are contributions, such as revenue we receive when we meet or exceed quality measures. The environment in healthcare now is to be able to account for that and award for that, as opposed to just paying for services rendered. And so we are fortunate that we're able to receive those dollars through our federal grants, as well as dollars through the state, such as through our Medicaid health home work that we do. We are enrolled as a provider, as a Medicaid health home, and if we meet certain measures, we're able to receive additional dollars for serving really complex patients in the Medicaid program. There's also some license revenue as well as fines collected in that area as well. So of the $12.2 million budgeted for 2017, 78% in total expenses. On the revenue side, 78% or $9.6 million is revenue generated through grants, contracts, and charges for services. So here's just a breakdown programmatically in a little bit more detail of where that money goes and how we spend it. So I'm going to give you a little bit of a snapshot of what is included in each of those as far as programs, so you get a sense of what we do for the community. So in the community health clinics, you can see that's the biggest piece of the pie. We provide medical, dental, behavioral health services, addiction counseling, nurse case management, social work, sexually transmitted infection screening and prevention, refugee preventive health, healthcare for the homeless services, immunizations, lab, and radiology. For vector control, we provide mosquito control. We also provide resource for nuisances such as bed bugs. Every once in a while, you might get a call regarding bed bugs and refer that to our department. And also, we've started doing some surveillance for those mosquitoes that carry the Zika virus, and I'm happy to assure you we have seen none of those in our traps as at any time since we've begun that program, nor have they found any in the state of South Dakota. Under code enforcement, we do nuisance enforcement. So for example, in 2015, we had 4,071 inspections performed for nuisance cases that were opened. Under the food program, we do inspection and code enforcement as well as licensing. Under community health and wellness, the majority of that are the programs and initiatives under Live Well Sioux Falls. Under the emergency medical services, most of that is our quality oversight and contract management. Under environmental health, that is primarily the water testing that we do. Public health preparedness is primarily what it says right there. We do disaster preparedness as well as community readiness for any threats to our community. Under daycare, we register daycares, we regulate we enforce the regulations that you've set forth, and we also have an inspection program. And business licenses encompass primarily sound permitting and tattoo code licensing and enforcement. So our operating budget is, we start at that baseline that you've seen with most of the departments. And the baseline budget in 2016 was $11.8 million. There are about 3 buckets that are the significant changes for the health department for the 2017 recommended budget of $12.2 million. And those are, as you can see here, wages and benefits are that $299,000 increase. $43,000 of that is actually in expense related to retirements that we'll be having or estimate or anticipate in 2017. We also have professional services. We do a fair amount of contracting, even though we employ many of our providers. We also contract for our providers. An example of that would be Center for Family Medicine, which is the family medicine residency program here in Sioux Falls. We are a training site for the residents, so both the faculty as well as second and third year residents practice at Falls Community Health and serve our patients at the clinic. So we compensate them for those services. We also have some provider expansion in there for some behavioral health services as well as addiction counseling that we've increased some yet this year and ongoing, so you'll see that included as well in the 2017 budget. We have a little bit of interpreter expense increase, lab and x-ray services, there's some increase there. Our EMS system improvements are included in that, and then collections, but those are also offset by revenues. Finally, the third category and the most significant change is in rentals. There's just a few things in there and not a lot of dollar amount compared to the other two. Technology charges, fleet charges, and mileage reimbursement. So again, our recommended budget is $12.2 million, and that encapsulates my presentation for you on our health department budget.
Thank you, Director. Are there any questions for Director Treats? Or I'm sorry, Councilor Staley.
Yeah, thank you. Thanks for being here, Director. I was wondering, is there a basic fee for medical visits? Do they have like a office visit charge?
Yes, there's several different charges. It depends on if you're a new patient and whether or not you're there for an acute visit versus something like a physical. It's usually by increments of time and intensity of the visit that we set those charges.
So could you give me an example of just a basic office visit?
Oh, you know, I don't have that off the top of my head, Counselor. I'd get that for you, though.
Okay. And then you mentioned the bed bugs issue. Does the health department treat the bed bugs, or how do you?
No, we primarily work with vectors that transmit disease. There are a lot of nuisance bugs in our community, bed bugs being one of them, but bed bugs are not a vector of disease, but they do garner a lot of concern in the community, and so we provide the resources to help them understand how to mitigate that in their home, or, for example, there's a lot more resources, so we don't get quite as many calls as we used to, because now the resources are much more plentiful and much more effective in our community, so that has lessened.
Thank you.
Councilor Erickson.
Thank you, Director. I appreciate you being here.
You bet.
I ask you this every year, so I should have probably forewarned you that I would ask again. Can you just talk a little bit about the school program and the relationship that we have with a couple different schools, and talk about just how that's funded for just reminders and
Sure.
as we move forward? Because I think it's a great program that we do, and I always like you to highlight it just a little bit.
Absolutely. Thank you for asking. We engaged in a school-based health center program around 2008, and then it's grown over the past few years, where we actually have sites at 3 of the most high-need schools, grade schools, elementary schools in Sioux Falls. So we started out at Hawthorne Elementary, and then we grew to Terry Redlin, And then the third was Hayward Elementary. And those were through expansion grants that we received, some dollars to actually build those services at those sites. So those are structures that are attached to the schools, which are great because they can be a neighborhood clinic, each of them. So they have an exterior entrance to the clinic, but they also can be accessed through the school. And so we've worked very closely with the school district to continue to grow that program of seeing children in need. We have some equipment to be able to serve patients for both medical primarily, but then also dental at Hawthorne Elementary. We have equipment to be able to serve them for their dental needs. We have some portable dental equipment to be able to serve both medical and dental needs at Terry Redland. And then we just kept learning what we were doing here with this school-based program. And we actually, with the third program, the third site, we actually have 2 medical exam rooms and then 2 dental operatories that were built in to that site. And it's one of the main reasons also that we did that. One was we learned how intense the need for dental is in those schools, but we also then know that school is just that much farther out, and so having those dental services on site were really advantageous. So we have staff that work at those sites, and that's their primary site. In addition to working at the main site, they get to know those kids, they get to know the patients there, and we take referrals from the teachers, from the nurses that work in the schools, as well as just anybody can call in and request an appointment if they live in that neighborhood, for example, and want to be served at that school-based site.
So it's complete, if I may, Mr. Chair, I'm sorry. If it's collaboratively with the school, however, it's separate, that it's a city-owned structure on there, and just really the relational aspect of having those services available.
Correct. I would consider it to be very similar to our community centers in some respects, if you think about it that way. The school district has been phenomenal. They provide some of the in-kind support, such as custodial and maintenance for those sites. I should mention that, and thank you. And are a really strong partner with us, and we continue to look for ways that we can maximize those sites as we continue to grow and understand how to, make those as efficient and effective as possible.
Perfect. Thank you for answering.
You bet.
And I ask every year, but I always like hearing just updates and highlights of how it's going, so appreciate it.
You bet, absolutely.
Councilor Kiley.
Thank you. Just a quick follow-up to Councilor Erickson's questions regarding the school-based clinics. Has the school district ever bussed in individuals from other schools that are in need of medical services? Have they ever considered that?
That's a great question. From other schools to that school. They don't provide those types of transportation services, but we certainly would not prohibit any child from being served at those school-based sites, just as we wouldn't ever prohibit them from being served at our main site. They're free to come to any of those, and we do have, some of that occurs where kids may be served. They might go to Cleveland, for example, and be served at Terry Redland, possibly. There's no limitation to that whatsoever.
Okay, great. And as a former member of the Falls Community Health Center Board, I've had the opportunity to go through
Yes, you have.
the clinics, and there's absolutely wonderful, and I'd encourage my colleagues to do the same.
Thank you. Councilor Starr?
Yes, Director Franken, thank
Sure.
you for being here today. My question's maybe a little more philosophical, but I'm looking at the Falls Health Clinic budget part. From rough numbers off the top of my head, it's about a quarter of the funding is from intergovernmental grants and funding from both federal government. I'm assuming a lot of that's probably Medicaid and maybe a little Medicare money as well. Talk to us a little bit about if we expanded Medicaid in South Dakota, how that would affect both your programs and the citizens of Sioux Falls.
Sure. Around over 50% of our patients are uninsured that we serve at Falls Community Health. And so while we are in important and critical access for them for primary care, those are folks who are on our sliding fee and pay based on their income, their household income, for their services. And yes, there are many services that we can provide within our walls and through our partnerships that can be of a lower cost. However, these are patients who say they have a critical need and they have to be hospitalized. Well, that is where the gap comes in. Those are patients that they go to the hospital and they are incurring 100% of the cost of that hospitalization if they're uninsured. And so for that one example, that would be a situation where if Medicaid was expanded and those patients were able to be on the Medicaid program, they would then have eligibility to be able to have their health care covered through whatever means was necessary to improve their health and their well-being. So oftentimes people tend to be a little bit more selective in how they access their health care because of cost. And so if we were able to expand Medicaid, we'd probably even see a higher rate of patients who we currently serve coming to be served and maybe more frequently accessing preventive health services rather than waiting a little bit too long before something gets to a point where it takes a little bit more effort to be able to get them to a better state of health.
Makes sense. May I just follow up a little bit? Of that 50% of the patients that you see through the clinic, how many of those do you think, if we expanded Medicaid, would qualify? I mean,
I can get you that answer more specifically, but I believe we have the majority of them are below the poverty level, which means that they would automatically be eligible for Medicaid. And then we have a fair number that are up to 150%, and a vast majority of them would also be eligible for Medicaid. Most of them would be eligible for Medicaid.
makes sense. It's something that I think at some point we need to look at as a council, putting on our legislative priorities as well, that we weigh in on this. So thank you.
Very good.
Councilor Neisert.
I have two questions, but you made reference to you used the term selective, kind of in terms of going to the doctor and not having coverage. And it's interesting. I was just reading an article. About 10 years ago, we were moved to a high deductible health plan in my large corporation. So I've had a health savings account and a high deductible, several $1,000s. And the idea was that you would, be a little more price shopping, doing that sort of thing. And what I found over the years is it's impossible to price shop with medical. There's no transparency. And as the article was saying, the studies that they've done has shown that people just don't go to the doctor as much with I'm not making a statement. I'm just saying that that's what they seem to be finding. So it's kind of echoing what you said. You don't have coverage, you just don't go. So, so two questions. The first is, and I think you covered this. There was a line for eligible leave payout. So that's essentially an estimate of the leave you're going to pay to people when they retire that they've built up. Is that right?
That would be correct. Yes.
Okay, and that's in other budgets as well. So, and then is there any, just generally, is there any, I guess, maybe headwinds, whether it be regulatory, insurance, things that you see coming down the line? You're such a volatile industry with healthcare and insurance that might affect your budget that you can think of? Well,
certainly, as we know, it's been in the news a lot and in common, communication circles that Medicaid expansion is on the governor's priority list for our state, and it was really close to being a special session item this year for a special summer session, but that did not come to pass. However, that is still something that I know the governor is very committed to and that they'll continue to be working towards in this legislative session. Medicaid expansion would be a game changer for us and would be then additional revenues that we would, we've already started saying we need to be planning now for that eventuality so that we can be well prepared for how that'll change, albeit to the good, our budget moving forward into the future. So that would be one of the most significant.
Okay, thank you.
Director, I have one question,
Sure.
and that is, are we looking to expand our school program, clinic program, to other schools at any time?
We have
Is that right now?
with the rapid growth going into this program of adding 3 school-based sites in a relatively short amount of time, what we want to do now is really get that humming along like we have at our main site. We continue to grow, we continue to learn, we continue to understand how to, maximize those resources. And so we want to get really good at that. So in the near term, that's not on our strategic plan, but certainly that could be expanding the hours at those schools would be something we might consider. We might consider exploring, maybe some expanded hours at our main site. Those are some things that we may look towards, especially with additional revenue that could come into the future. Those would be things that we'd have to take under consideration.
Thank you. Seeing no other questions, thank you very much, Director Frank.
Thank you. Thank you.
Next, we have Transit with Director Cooper and Sam Trebelka.
Good afternoon, council members. I am Mike Cooper with Planning and Building Services. I'm going to be turning this over to Sam shortly, but I wanted to just start out by, again, emphasizing the level of work that has gone into this budget presentation today. The finance team, Tracy, Tom, Ann, and others, along with Sioux Area Metro, have put a lot of resources into trying to provide you the best story as far as where we're at with our transit system going into the year 2017. And the mayor obviously previewed a little bit of this in his budget address to you and to us, as well as Sam provided a briefing a while back as far as where we're at with some of our ongoing challenges with our transit system and looking at this transit development plan of helping us guide the program going into the future. So just keep in mind that I know a lot of people pay attention to transit. A lot of people have strong opinions about what we're doing good, what we're not doing so good, what they think we could do better. But as you'll hear today, and some of you have heard this in the past, there's some significant issues that we have to figure out going forward if we're going to continue to expand and improve our transit system. Because we obviously want to provide a quality, reliable, safe, and sustainable system for those people that choose to ride our transit system, whether it's by choice or because that's their only option. So with that, I'll turn it over to Sam because he is by far the most knowledgeable about what's being presented to you today. So thank you.
Thank you, Mike. As Mike had mentioned, a couple weeks ago I was here, talked to you, give you kind of the background on a lot of what I'm going to discuss even today. So I might go back, and I'm not going to repeat all of that, but I did want to do that so we'd give you kind of a basis. And but we're going to mainly focus on 2017 today, and then talk a little bit about what we're going to need to do into the future too. I mentioned also Sioux Area Metro staff that are here today too that help with the budget together are Eric Meyerson, General Manager, and then also Dennis Erkfurtz, the Operations Manager. So with that, I'm going to start a little bit about ridership. Where have we been with ridership on a per trip cost basis too? From 13 through 15, you'll see that ridership both on fixed route and para has come down. Different stories for each. Fixed route ridership has come down from really a high of a little over 1 million to about almost 900,000. There's a few reasons for that fixed route ridership has come down. First of all, we've made some adjustments. Number one, the trolley. Number two, some school services. So there is some ridership that we made some decisions on that did help move towards some of that reduction. Also, during that time, we've seen the economy improve. People are less likely to use the fixed route system because of that. Gas prices, of course, have come down. Some of those kind of things. We've seen that around the country, that there's been some of a slight reduction in fixed route ridership because of that. Paratransit ridership has gone down. That's by design. That's something we've been working towards and would continue to look at seeing a reduction to. We're looking at ways that we can reduce that and move some of those paratransit trips to more efficient methods, whether or not it's through Project CAR or also through a new nonprofit called CCTS, or Community Coordinated Transportation Services. We've started to do some of that. And those kind of things you'll hopefully see into the future. Fixed route and paratransit cost per ride have gone up a little bit. I don't think it's significantly more than what the inflation would require, but it has come up a little bit, as you can see there, up to $4.50 for fixed route ridership, and paratransit this past year was $28.21. Transit use funds. For 2017, this is what we are, what we're suggesting, what we're recommending. SAM operating expenses at $8.3 million. Other operating expenses, a lot of the other operating would be what I would call some of our efficiencies initiatives, like $7 a ride to CCTS for rides, agency rides that are coming off of paratransit. Also doing a $10,000 contract with Active Generations to move some paratransit rides onto Project CAR. We're making huge savings by doing it that way. It's kind of the carrot approach to doing it that way. Some of the capital expenditures for next year will be $1.7 million. So overall, that's a $10.3 million cost for transit next year. From Sioux Area Metro, you'll see about $1 million through fares and advertising. From the transit fund, you would see next year a requirement need of $9.2 million. So where are we going to come up with the funding for that? Most of the funding, and we talked about this last time that I discussed, most of the transit funding is coming locally. In this case, 2/3 of our funding comes from local sources, either the general fund or the sales tax fund for capital or for the operating expenses. The rest of it comes, what we're showing here is intergovernmental, but almost the entire share of that, it's the federal government, either through federal capital funding or through the federal operating assistance, which is really a lion's share of it. So the total revenue there is a $9.4 million. What is our capital budget then? What is that made up of? We're looking at most of the budget for the capital is going to go next year for the bus stop canopy project or for the bus stop project itself. We're going to really do a nice facelift to that. Most of that is going to be the replacement of the bus stop canopy, though. That's probably the most expensive part. That's really something that needs to be redone. We'll also be replacing 2 paratransit buses. Also looking at the GPS tracking system that'll help us improve and become a part of our paratransit scheduling software update that we're including into right now into our paratransit system. We just purchased some new paratransit software, so that GPS tracking system will help with that. And then also 1 pickup. The bus stop canopy is about $1.1 million of that capital budget. Now beyond 2017 and really incorporating as a part of 2017, we go back to our 2014 task force recommendations, and this is where we're trying to go and where we're continuing trying to go. Goal 1 is to reduce the cost of paratransit. We're really looking at over that 5-year period, and we're into that 5-year period, reducing the cost by $1.8 million, down from 48% of the total operating budget down to 25% of the total operating budget. Goal 2 then is on the other side of it, is to be able to, in part because of the reduced costs in paratransit, to be able to increase fixed route services by about $1.6 million. So that's everything else beyond that goal 3 and 4 help us move towards those goals. Goal 3 helps us with a community-based system, collaboration, coordination, whether it's with Project CAR or with a new nonprofit coming to town, that helps us with paratransit costs. What we can do with Goal 4 helps us with Goal 2, which is to increase our fixed route services to be able to utilize those fixed route services with an enhanced travel training program. And then, of course, we continue to come back to you every year and show you where we're at with that, with Goal 5. I mentioned last time some regional comparisons that also kind of help explain why we're trying to move this direction. Sioux Falls is a much higher paratransit ridership than in most all other areas of the region that we compared. As you might remember, we did a comparison of 20 other transit systems around the country, and we were 1, 2, 3, 4 in that area in terms of paratransit ridership or paratransit costs. Sioux Falls also has a much lower fixed route ridership in the region, so we want to try to help bring that more in balance to the way some of the other systems are operating around the country. Also, 3, State of South Dakota provides very little funding. As I showed you earlier, most of the funding is coming from locally, and so we want to make sure we're utilizing that in an appropriate way. Sioux Falls local taxpayer pays much higher share of the transit costs on a cost per basis. That helps. As I mentioned before, 66% of our budget comes from the local taxpayer. So what needs to be done? As I mentioned, our paratransit costs are higher than most other places. Most of that is because of the agency trips that we have on our system. When we look at other areas around the country, those agency trips just are not a part of the system. They're either being charged at a different rate or they're trying to find different ways of doing those trips. We also want to, as I mentioned before, expand the fixed route services. But why we highlighted or bolded those two things is one is very dependent on the other. We will not be able to expand our fixed route services unless we are able to get control over agency trip costs or agency trips. That becomes more clear to us the more that we get into this. When we're able then to, if we're able to expand our fixed route services then, we'll be able to expand our paratransit services. As you might remember, there's an area that we're required to provide paratransit services, an area within 3/4 of a mile of that route. If we expand our route, then paratransit would be available into that area. So we want to be able to do that in a prudent way, and you'll be able to see more of that. If we're able to stick to our projections, we think we can do some expansions to the service. And we'll do that as part of a transit development plan that we'll be bringing forward on the heels of this budget to be able to provide a good 5-10 year plan for you for expansion and also for policies, how we can control some of those agency trips costs also. 2017 is a really important year for us to be able to gain control of some of those agency trip costs. We will need to be able to do about 20,000 trips, move 20,000 trips from paratransit to some different coordinated services. Most of that would be, we would hope, on river cities or community coordinated transportation services. We have that in the budget to do $7 a ride, but we need to see some coordination, and we're continuing to work on coordination with those agencies. We've started a pilot project, and we're having some pretty good success. We need to be able to transfer that to next year. There's probably somewhat of a gap in our budget, but some of that is by design to see some coordination, not only just in how we're doing this, but in the financing of that. So that we think that's really important for long-term sustainability of this kind of a model. Without that, we're probably looking at a $300,000 gap in our budget. With that, if we aren't able to, we'll have to probably start looking at cuts somewhere else to our budget. And this is really critically important to understand. If we don't, we're probably looking at some fixed route cuts. And so that's why it's really important that we move forward with it. Otherwise, we'll have to make some tough choices on the other side. We will continue to want to make some appropriate balance between the taxpayer and user support over the next couple of years. Probably not, we won't have to probably look at it next year, but the year after we'll probably have to look at an increase in our monthly fixed route rate that we just moved to $30 last year. We were looking at as part of our transit task force report about every couple of years, every 2 or 3 years, we'd look at an increase there. Also is plan for capital cost, looking at how we can expand and replace our system is extremely important, especially as we get into the future. And everything that we do in terms of replacement of our capital, most of that is buses, of course, is done within the transit fund. Now, in some cases, we're going to be building transit fund to be able to help pay for future expenditures of buses. This year, within the budget, there was 5 fixed route buses, which are over $400,000 each. Next year, we don't have that, but we're going to have the canopy at $1 million. So this kind of helps. We're starting to do with a huge amount of help from finance on this, and looking at this is looking out quite a number of years here. Really, you can see in this case, looking out 12 years, that we think we can maintain our transit fund at a pretty good balance out to about the year 2026. After that, we're starting to see we're going to have to start doing some other things. But it's important, in this case, if we can gain those agency reductions that we're talking about and do them in a different way and do them in a coordinated way, we can get those route expansions. If we don't do the agency reductions, you're on the red line. And that's even without route expansions. If you do no agency reductions and you do try to do the route expansions, you can see where you're at by 2026. You're well over $10 million in the red for your transit fund. So these are what we start doing next year is going to be compounded over the next several years. So it really becomes very important. With that, I would take any questions.
Thank you, Sam. Are there any questions for Sam? Councilor Kiley.
You had mentioned the addition of GPS tracking system. Mm-hmm. Would that, any possibility that for our users, that apps would be available that they too can track where the bus?
This is what we're looking at going that, but these would be for the paratransit buses, at least to begin with. Okay. I think that's right, isn't it, Eric? Just for the para. Yeah, and so we're looking at in the future trying to do the same thing with the fixed route buses. But this is what will get us for GPS. The paratransit software, scheduling software that we'll be able to that we're just in the process of incorporating into our system. We'll also have the ability to do some additional things for customer support, customer service. And that would include, for instance, if people wanted to know when their bus is within 10 minutes, the GPS would help with that, because then they could get a text message or a phone call saying, hey, your bus is 10 minutes. Otherwise, what's going on is they have a 30-minute window, and they just have to kind of wait and look out the window and wait and wait. And if they don't and they miss it, it becomes an issue. So we're trying to do something there that we think will do some improvements. It'll also help you provide day of the trip. So that will help too with our no-shows.
Right, and I appreciate your efforts in that area. And then my other question, I know that I had highlighted goals 2 and 3, and then later on in your presentation on slide number 20, you had also put in bold print control agency trip costs and expand fixed route services, because they do go hand in hand.
Yes.
What are some of the challenges that you face in terms of controlling those agency trips? What are some of the roadblocks? Or
yeah, well, I think you got to go back quite a while. We've had these agency trips on our system for well over probably 20 years. Since paratransit became, you know, in the 90s, something that was a part of our system, a lot of the agencies gravitated to paratransit because they were using a community resource that was inexpensive. But the reality is that that is a cost that is then totally borne on the transit system and not kind of a shared cost as it really should be and is done around the country. So that model really makes it difficult for transit when you have to bear that entire cost.
And the challenge lies in that you're
Trying
trying
to change
to
that.
wean them off of something they've become used to.
Yes.
Okay. Thank you.
Councilor Erickson.
Thank you. Thank you, Sam. I have a question in regards to the project for the canopy cost. My question in regards to that is what, I know you said it's in poor condition. I know it's only about 36. What's probably not, it's probably older than 36. It's just the last update was the 80s, right?
Yeah.
So where are we as far as what's wrong with it?
Yes. Right now, Council, you approved, you might remember, a design contract with Walker Parking Consultants, and so they're doing the design, construction design for that. So that'll be bid probably, we're hoping, late this year, and then we will look at starting construction sometime next year.
So what are the issues with the canopy, though? Is it leaking? Is it rusty? Is it?
Yes, it's drainage, and it's become a very I don't know if the best way to put it, Eric, but it's over a number of years it's becoming in disrepair. I mean, it's a lot of it's the drainage that's eating away into that concrete, and over time that's going to become a real problem. We certainly, if we left it for 10, 15 years, of course it would just fall over and become a huge hazard. Right. But we know that it's due.
Right. Thank you.
You could use Director Cotter's famous words. It's
tired. It's tired. The canopy
yeah, it's tired. Yeah.
Councilor Selberg.
Thank you, Mr. Chairman. Thank you, Sam. When you look at page 7 and you look at the transit ridership as it's slowly declined over the last 3 years, are there any projections for 2016 at this point? Are we on a continued heavy decline? Are we going to be leveling out a bit?
Well, I think there's probably, to be truthful, there's probably still some declines to come because we just approved school services or tripper routes to end. And so there's probably 50,000 trips there. But, that's why we want to really continue to find ways to improve the system. And you'll see that with our transit development plan and strategies to improve our system. A lot of it's because people don't know how to use it, or in a lot of cases it's very difficult to use regardless if you even know how to use it. So it's important that we update it.
Okay, thank you.
Councilor Neisert.
Sam, is the 2014 Transit Task Force report the last major report that's been out? Is that right?
Yes.
I'm looking at here?
Yes.
Is everything in there still pretty much accurate and valid, that'd be valuable for all of us to review?
Yeah, generally okay. It is. I mean, there's things that we've been implementing that have changed some things, but generally it's still pretty accurate, yes.
And then can you go to the page, the transit fund balance, where it shows it going down to 15 million? Or negative 15 million?
Kind of the last slide.
Yeah. Can you, so yeah, I should probably know this, but what is the 15 million, what is that representing? 15 million what? That we would?
Well, obviously you would never want that to become, I don't think.
Well, just explain what the number means. Is that cumulative over the years of the
yes.
losses, or what?
Yes.
What is that representing?
So it'd be like 15 million, it's maybe, $1 million a year, even though it
over and above where we're at right now.
Well, we have a surplus right now. I mean, we have
a fund.
We have some money in the fund.
Okay, yes. All right. So this is representing the
yeah,
actual,
you can see
the balance in the fund declining into the net, and that we'd have to. Okay.
Yes.
How much is in there right now?
Do we know how much is it? I think it was $1 million.
Ballpark.
Yeah, it's at least I know that over the next year we were looking at it coming down a little bit.
No.
2 million?
question.
It's 2 million right now.
It's what?
2 million.
2 million? Okay. Okay, that makes sense. Thank you.
Councilor Erpenbach.
Thank you. Thank you, Sam. What's that 2 million set aside for?
Well, the 2 million is like in any reserve fund. We're building up some of that reserve fund to be able to help, especially pay for some buses that are coming down the road. That's capital replacement planning has been a big part of what finance has been helping with. Before, when we had the federal funding at 80%, that's what we were always planning for. We didn't necessarily need that transit fund because we would just plan for 20% requirements. Now we can't necessarily do that, so we're having to replace, in a lot of cases, we'll have to do 5, 6 buses in 1 year, while another year we only have to do 1 or 2. So we do have to build that transit fund balance up, and then we have to pay some of it down, and that's what's kind of being reflected in that chart up there.
Second question, Sam. Slide 19, a little bit before this. The Sioux Falls has a much higher paratransit ridership in the region. Can you define that region? Does it include Omaha, Des Moines, or is it just define that region for me?
The region that we looked at was really from Wisconsin to Idaho, North Dakota to Nebraska, Iowa, Illinois. It was within that region, Minnesota, Wisconsin. We looked at Omaha. I mean, the city of Sioux Falls has a higher paratransit ridership than Omaha. It has a higher paratransit ridership than Des Moines.
And their population in Omaha is probably double ours, right?
More than double. It's 700,000 in Omaha.
Those are some pretty remarkable statistics. My last question, if I might, Mr. Chair, is just, can you talk, Sam, about when should we as a council expect the next rate increase? And what might be some of our strategies when we sit here and look at this and go, yep, right, we need to do this. And then when people come crying to us about rate increases, we all go, oh no, we're not going to raise rates. We all do it. I'm just as guilty as anyone. Can you talk about when's that next rate increase and what are our strategies for coming into that so that it's maybe easier to stomach, maybe easier for us to handle as well?
Well, I think what we talked about in the paratransit task force is to look at more than every 20 years. We look at doing it every 2 or 3 years. So certainly over the next year or two, we should look at raising our monthly fare, at least our monthly fare on fixed route ridership, fixed route service. Otherwise, I don't know if there's many other things that we would increase right away, but over the next 5 years, we might want to start looking at some of the other rates too.
Well, I think just from a personal standpoint, I look at, and no offense to Feeding South Dakota, but they built their new building not on a bus route. Right. And creating some concerns, at least from my standpoint. I'm our representative on the Homeless Advisory Board. I know a lot about people that are going without food on a daily basis. This is going to be a struggle for those families to get to that important resource.
Yeah. And I'll mention one other thing a little bit for the nonprofit that we're bringing in, which is River City and Community Coordinated Transportation. They're hopefully can fill in some of those gaps. I know they've been in contact with them about potentially some service. Now they might just do one day during a certain couple hours from a certain area, but hopefully they can help fill some of that gap. But you're right, we need to look at some of the locational decisions that companies or people make needs to be also in coordination with our transit service.
Right, exactly. Thank you.
Councilor Neisser.
After the budget presentation, there was some discussion in the media about, at least from one agency, in reference to whether or not they could essentially pay for part of this. Yeah. And they said it wasn't, I don't know if the word was realistic or not. Where is that at? Is there discussions that are ongoing to,
Yeah, I'm meeting with them next Wednesday. And meetings are ongoing. That organization has been great as part of the pilot project. They actually right now have about 173 rides a week that are being done as a part of River City's project. So we'd like to see that continue. But you're right, it's how we can help bridge some of that gap is going to be the challenge.
Councilor Staley.
I have two questions. One of them has to do with the size of the buses. It was discussed in the past about maybe having some routes that would have a smaller bus that would service those areas. And then someone said to me, well, it costs just as much to run a smaller bus as it does these larger ones. So I wanted you to address that. Sure. And then the second thing I was going to ask about is how many bus stops do we have in our community?
No, bus stops, I'll start with that one. I believe there's like 400. 400 bus stops.
Well, and I notice sometimes when I'm driving by, some of them are covered.
Yeah.
You brought up the canopy thing. Some of them are out in the open. What determines what kind of shelter you're going to have on a bus stop?
There's a couple of things on shelters. First of all, we most target our shelters to areas where there's a lot of pickups or drop-offs. So the areas that have the most, we would target those, because obviously we can't have 400 shelters. That would be difficult for just maintaining at the very least. Second of all, some of it is dependent on also being able to work with the landowner on either an easement or a property to be able to site that, because not all the time is a right-of-way available for that shelter. So those two things really go into that. And we're looking at trying to do 3 or 4 even this year. We're looking at trying to do one in the Hayward neighborhood across from Hayward School.
A sheltered one?
A sheltered one.
So this is something ongoing that you're wanting to provide more of that at a bus stop for people?
Absolutely.
Okay.
And then on your first question, in terms of the buses, on fixed route services, our buses, we're actually trying, you're going to see more larger buses, more the 30, we have 30-foot buses, and then we've gone to some 35-foot buses because we have some routes that are peak hours, or in some cases all day long, we're so packed that we were having a lot of people standing. So the 35-foot buses were something you'll probably see more of. If you see some of the routes that are empty, especially during the midday, that's probably because just like a street. And I'm sure many people from Public Works could attest to, we build our streets to peak hour. And many times those off peaks, you don't have nearly the need. You could have a 2-lane facility at off peak easily, but you need 4 or 6 lanes at peak. So that's what you build to, and that's what we build our buses to. The same thing with paratransit. Our paratransit fleet, we'd love to have a more flexible paratransit fleet, and that's one of the things that we would be working towards, because that would help on our capital. A lot of places have vans, or they even do use taxis, but we need 23 buses at peak hour that are huge buses because of our group trips, and those are there because of the agency trips.
Thank you.
Yep.
I've always heard, Counselor, that this is the one place that I can think of where, unlike churches, you have to build it for Easter and Thanksgiving, or Easter and Christmas, rather than what's there on a regular basis, because you've got to be able to provide that many spaces for people. So, yes, Councilor Kiley.
One more question, Sam. I recently participated in the selection process of a transit provider, and during that process, we had heard that they had suggestions or strategies for improving route efficiency as well as ridership. At what point will we actively be able to explore those?
Well, I think those are some of the things that are ongoing, but as we complete, the transit management contract for the next few years, those are some of the things that I think we want to incorporate and try to work towards with some of those ideas that were discussed even that day, and that's a good reason why we continue to look at updating our transit management contract every so often. So yeah, it's a good point.
Okay, thank you.
Hearing no other questions, I have one, Sam, on the slide 21 of transit fund balance. You indicated that you thought this reserve funding the reserve funding was going to go down. It indicates on this that we're probably going to go up in the next couple of years.
Yeah, after 2017, it'll go up. We'll build up our transit fund into 28 and 2019
And
to try to be able to buy some of the buses into 20 and 21.
On 20 and 21, and that's what'll bring it down in 22.
Yeah.
There isn't any special event there? I'm thinking of.
No, we're
when
just
we
buying, we're required, because of the age of our bus fleet.
Yep.
And we bought 17 fixed route buses in 2009. When those are getting, into that area.
Yep.
We need to start.
Okay. I was just wondering if that was the projected time for us to go to 200,000 population, which would change our funding a bit
Nope.
too?
No, that doesn't.
Okay, it's got to be close right in there too.
Yeah, we would project that it'd be after 2020, it'd be more like 2030 that would become an issue for us, I think.
Okay, thank you very much. Okay. Mr. Cooper, Planning and Building Services.
Okay, I want to just start out by, again, thanking the finance team for helping put this together. And just starting out by, again, emphasizing the story of our department. What is it that we do and why do we do it? It's pretty basic, managing the orderly development of Sioux Falls, ensuring public safety in building construction and maintenance, and overseeing the protection of property. So we have the planning division, we have building services, and we have zoning. And each of those has a pretty specific mission as far as what we provide to the community. So what we do in terms of metrics with the planning and zoning team, just over 4,700 zoning inspections. These are some statistics from last year. Over 1,100 code cases. So in terms of zoning enforcement, many of those have to do with illegal parking, the way that businesses are operating, signage, landscaping. It can involve a lot of different types of cases. Over 2,160 sign and fence permits. We were involved in reviewing almost 1,400 acres of land that went through a platting process. Almost 100 applications went through our planning commission. And then also a lot of what we do is helping assist other departments, other organizations. Obviously with a lot of involvement, it could be working with the Public Works team on a street project. It could be working with the Parks and Recreation team on a neighborhood park project. It could be working with the community development team on a new business or a redevelopment project. In the past, we've helped the library team look at future branch library sites, fire inspection, future fire locations, fire department locations. So a lot of that doesn't get a lot of attention, but it is a big part of what we do. On the building services side, obviously the big focus that you hear every month from Tracy Turbeck's financial report is where we're at in terms of building permit construction. And so that is a big part of our story, but also when we look at the number of permits issued, again, last year over 12,090, and then almost 61,000 inspections. Another part of our involvement that maybe a lot of people are not aware of is that we're involved with oversight of over 2,800 licensed contractors that do business within the city of Sioux Falls. And so we deal with managing their licensing to make sure that they're up to date. We do testing to make sure that they're qualified to be a licensed contractor. So that involves a lot of staff time and a lot of oversight. And just again, to kind of reflect on what we do, we recently gave you an update on the Midco Aquatic Center, and I thought this was interesting. This was through August 1st that with the Midco Aquatic Center, our building services team performed 138 different types of inspections. This is including the building footing, the framing, electrical, mechanical, and plumbing. So a big project like that, obviously we get involved with quite extensively. So orderly and efficient development of Sioux Falls, what does that mean? We typically try to do some major plans and reports within our own staff resources. And as an example, some of those that we've done recently, we have an ongoing strategic plan that we do in terms of our planning and building services team. Again, identifying what we can do in terms of helping to identify whether it's a well-being program or ways that we can better organize our staff, looking at how we can communicate amongst our staff so that we know what we're doing and why we're doing it. A big project that we took on this year was updating our floodplain mapping and ordinance. We were involved with Public Works and others on updating our long-range transportation plan. We helped develop a new bicycle master plan. And also, we worked on the transit task force, and now we're doing the transit development plan. So these special types of projects come up every year, and it's important that we are able to do those in-house. We average about 32 days from the time of a development plan application comes to us to the Planning Commission hearing. We want to continue that timeline as well going into the future. It's also important that we explain what we do, why we do it, out into the community. With our new codes that we've updated, we're out talking to contractors, to the different industries to help them understand what those new requirements are. And again, looking at the contractor's ability to implement those codes. Shortly, we'll be bringing you the new uniform plumbing code that we want to get adopted yet this year, and our ongoing implementation of zoning ordinances and other city requirements. So our timeline for the Planning Commission is going to continue around that 30 to 34 days. And we've also, again, identified in next year's budget some of those special ongoing plans and reports that we want to do. Enhance our customer capabilities with responsive and efficient service. We really made a huge difference when we remodeled our service counter ground floor of City Hall. We can do our residential applications within 1 day, and non-residential requests for inspections to actual inspection within 1 day. So we spend a lot of time focusing on customer service and trying to make it as easy as possible to make it through either coming to the counter or utilizing our staff out in the field. So one of our big steps that we've been working on for quite some time is to make that transition to online licensing, permits, inspection requests, and payments. With our new online application that we're going to be rolling out here shortly, we're going to begin the first phase of implementing that. And I think that's going to be pretty exciting for the community. We've done some testing, not only with our staff, but also with some of our contractors to make them aware of, in the future, how they're going to be able to use this new online service for requesting inspections, for different types of permits, and then eventually we'll expand it to plan reviews and even more long-term things like code enforcement. For our particular inspection team, the big change is we're going to be having a new device that we can use through InterGov called the IG Inspect mobile application. And the picture shows you what that device looks like. It's not a tablet, or it's not a laptop, but it's more like a tablet that we can use out on the field. It's very hands-on, it's very efficient, and it's going to provide the ability for our inspectors to do their work more efficient, more time quality in terms of the number of inspections, and getting from one type of inspection to another. Another big change that we're looking at that will help us is that some of our inspection team takes up time not only doing the inspections, but also getting involved with invoicing and billing for different types of cost of inspections. With our new online service, some of that will go away, but also we've been working with our finance team to allow us to utilize some of their existing staff to help take away those invoicing and billing activities away from the inspectors, away from our permit technicians. So right now we're looking at, within City Hall, how we can house the finance team to get them closer to our service counter, to our existing staff, to again provide that support for the billing and cashiering activities. So again, that's going to create some really good efficiencies going forward in terms of our customer service. This is a summary of information that you've seen before, and again, just focusing on where we're at in terms of building construction activity. And I won't jump ahead of Tracy's next monthly update, but right now we're about $200 million behind our total for last year. We're approaching about 2,000 new housing units year to date, 2,000, which would be single family, townhomes, and multifamily. So construction activity still is very strong in terms of overall development activity. Are we going to continue this for the rest of the year? That's yet to be seen, how the numbers will go forward between now and December. But with our new floodplain ordinance, as we've mentioned, we're hoping that that's going to open up a number of projects that have been kind of in a holding pattern, waiting for those new maps to come out. So through the rest of the year, we're still anticipating that there's going to be a variety of development activity that we'll see. But again, we're not just focusing on the value, but we look at those number of inspections. You can see last year it was, again, about 61,000. And even with the smaller projects, whether it's a residential or a non-residential project, those type of inspections will continue on into the future. Our budget is not very complex, so for 2017, the request would be $5.9 million for operating and about $200,000 for capital, with a total investment of $6.1 million. Our revenue sources for the operating budget next year comes from a variety of sources. The big one are licenses and permits. We have some other intergovernmental, we have some transportation funds that we get, as well as some Board of Preservation funds. But overall, the revenue that does not come from the general fund is about 60% of our total operating budget. So about 60% of our operating budget comes from revenue other than general fund. The big change for next year is a $200,000 bump in the personnel costs. Our other operating costs are going to be flat for 2017. So we're looking at, again, that total of $5.9 million overall. And where's that going towards? The wages and benefits will go up about $240,000. And as you heard before with Jill Franken's budget request, we're also looking at some retirements next year. In fact, we're looking at some potential senior level retirements. And so within our 2017 budget, we have about $60,000 identified to pre-hire some folks in anticipation of going through of implementing a transition plan, as well as funding for those retirement payouts. Otherwise, the normal increases that we would see for next year under wages and benefits are about $180,000 of that total. Under professional services, this year we funded 50% of Expo building restroom project out at the fairgrounds. That was kind of a one-time request. So that would be a decrease that we're not going to see in the 2017 budget. Our rentals under technology and fleet, as we add more inspection vehicles or replace vehicles, those are added to our fleet charges that we're responsible for paying. And also under professional services, we have intergov fees that we'll be paying for next year of approximately $50,000. We're going to continue to support the Arts Council, Sculpture Walk, and also a decrease that we're looking at in next year's budget under professional services is that we're going to reduce under our code enforcement demolition budget about $40,000 because we've determined that with our code enforcement process, we're no longer seeing the number of building demolitions that we did maybe 2 or 3 years ago, which is a good thing. So we're able to reduce that budget within next year's request. So that gives us a total of overall of $5.9 million of our request. So real quick, real simple, and open it up for questions. I know you're all waiting to hear about Public Works, so.
Oh, yeah, yeah. Councilor Erpenbach.
Just the little cat that you almost let out of the bag about potential retirements, and then you kind of look over your shoulder. I'm just wondering, is anybody going to spill at this point, or do we have to wait?
I'll wait just a little bit.
Oh, Councilor Neisser.
I'll throw you a bone. Here's a couple. So you're talking about buying 6 pickups. I assume that these are the ones you go out and do inspections with. Are they just replacing? Or?
Yes, we have a replacement schedule that we work through fleet, and so depending on the age and the mileage of the vehicles, every year we have a schedule for replacement.
Okay.
Since we're not adding any staff next year, there will not be any additional vehicles, but just replacement vehicles.
Okay. And then, so there was a law change, and you have to make bigger signs, as you know, for rezonings and stuff. The dimensions are pretty big, if I remember right, state law.
That was about 2 years ago.
A couple of years ago. Do you, does multimedia make those in-house, or do you buy those externally? Or?
We buy those outside. It's an outside vendor.
Do you know offhand how much those are? I had heard somebody tell me a number, and I was
I'll find out. I don't.
A little surprised if it's really that expensive, and I didn't know if it was,
I will get you that information.
Okay, thank you.
Councilor Selbert.
Thank you. Thank you, Director Cooper. Just a quick question. This average of 32 days from time of development plan application to the Planning Commission hearing, is that about where we need to be? Has it always remained steady around there? I'm sure people who turned in would like it done yesterday, but.
Sure. The Planning Commission meets on a monthly basis. So we typically want to get those applications in so that we can prepare the staff reports and do all the background work. So that's kind of a set timeline that in a very unusual circumstance, I know the Planning Commission has had a special meeting, but it's been very, very seldom. So, but that's the purpose of the about a month application period.
It's here about as quick as it can. Okay, thank you.
Mm-hmm.
Councilor Neisser, another one?
Yeah, I something I remembered. I was watching Planning Commission meetings, and you have, it looks like maybe you have some interns. At least there was one named Sophie.
Yes, Sophie is our intern.
Okay, and is that something where during your peak periods you've got, some of these are obviously going to go back to school?
Yeah, she's been here during the summer. She's an MPA student at USD, and she's just been very, very helpful in particular working with the zoning office on a variety of projects. But we've also had her go out with the different inspectors so she can understand, again, what do inspectors do and why do they do it. We have 2 temporary staff that work the 28 hours a week. One is primarily helping with the licensing, and the other one is helping with some of the administrative work on the planning side.
The timing probably works well because it's probably during your peak period and while they're out during the summer for them, and then they get the experience.
Right.
Good thing. Okay,
Yeah. So
thanks.
this is her last week. Okay. Yes. Sophie Johnson.
Mr. Chair, I would remind Mr. Cooper that she is a Lincoln High School graduate, too.
Okay.
So it's pretty awesome.
Yes. All right, that makes it even more awesome.
Right.
Okay, all right. So noted.
Suppose she was in a band, too.
Actually, I believe she was.
Yeah,
Making her an outstanding student.
Thank you very
I'm sure
much.
she is. Nope, we're not done.
Oh, well, I won't thank you yet.
The other question, is there any backlog for inspections at this point? Are we
No.
pretty much right up? If we're doing it within 24 hours, we should be.
Plan reviews, the inspections, we're keeping up with,
Good.
with the folks.
Are we spending a lot of money on overtime?
No. We're not unreasonable according to our finance team. So, yeah.
okay.
You know, we'll have, you know, our office hours are 7 a.m. to 5 p.m., and we're open during the lunch hour. So we'll have, occasionally we'll have an inspector that's out later than 5, but, you know, to serve that many hours during the day,
Yep.
that's kind of how we cover that.
Super, super. Okay, thank you,
Thank
Director.
you.
Okay, I think that brings us to an end. Oh, no, wait a minute. We do have Public Works, I guess, is one more. Director Cotter.
All right, thank you, Chair, and thank you, Council. Our entire management team is here, along with the finance team, and we appreciate the opportunity to be able to present our budget to you. In Public Works, we really have two key focuses. We manage the transportation system, and we manage the city utility systems. We have some supporting groups that wrap in Public Works as divisions, but those are our two primary points. We have a budget to present to you today of capital and operation of $190.1 million, and we'll take you through all the respective divisions. You have 307 full-time employees in Public Works that work for you. Many of our operations are 24/7 and stand to deliver the services to our customers. Let's get started. We have a number of slides. We have added a few slides just for some additional education with 4 new council members. So let's get started. All right, so we have really 4 different funding areas of how we organize Public Works. We have general fund divisions. We have special revenue, which is the storm drainage. We enterprise funds, which are user fees, where the users pay for those respective services. And then we have an internal service fund where the partners pay into fleet for that centralized fleet service. And we'll take you through each of those respective divisions. All right, holistically, our job is to plan, design, and maintain the infrastructure in the public's right-of-way. We deliver fresh drinking water, collect and treat the wastewater, build and maintain the storm drainage system, deliver power to our customers, and maintain the streetlight system. We operate the 5-county regional landfill and the household hazardous waste facility. We have an environmental team that provides leadership in environmental and sustainability matters, and we provide centralized fleet services to the entire city departments. Let's start with general fund and those divisions that are in general fund. All right, this is a very visible aspect of what we do, which is street maintenance and snow removal. Total investment in highways and streets is $80.8 million. This covers operational and capital investments for not only engineering, snow, street maintenance, and storm drainage. This is the summary slide. Has a number of numbers on it. The key line to look at is the lower number, and it's a comparison of 2016 to 2017. 2016 budget for total highways and streets was $71.7 million. 2017 is $80.8 million. The key differences are we're going to invest a substantial amount more in storm drainage. The council's been very supportive in raising storm drainage rates so we can invest the right amount of money and bring up our drainage systems to their standard, as well as there's some additional capital dollars that will be spent as well to equate to an additional $9.1 million difference between 2016 and 2017. Let's start with engineering. Engineering really has 2 key functions. Engineering works closely with planning and building services. That as land is annexed and ultimately roads are laid out, land is subdivided, engineering's role is to make sure that that work is done to the city standards. You know, often in front of council you ask about roadway layout, access, drainage. They play a significant role with that. The other key thing that engineering does is the entire capital book is their responsibility to carry out. And so whether it's a new roof on a library or a new 12th Street bridge, they assign a team member and they run that project from concept through construction. We also highlighted today just one of the key aspects of engineering, which is traffic engineering. We've bought the most advanced system for 26th Street. It's called Adaptive Traffic Control Systems. Large metropolitan areas are using these, and essentially they do what the title is. They constantly adapt to the changing traffic patterns. So whether you're there on a side street midday, you don't have to wait for a pre-timed service to cue the traffic signal. They also ramp up better to peak hour, and they ramp down better to peak hour. We've got a number of corridors today that are best fit, where we pre-time all the intersections based on the time of day, and we're moving more toward adaptive systems. We currently have an RFP out on the website that we're going to source the next vendor to put adaptive system in on Minnesota Avenue and 41st Street. We should select that vendor this fall and do a full deployment within the next 12 months. So just a breakdown of the engineering budget. The key change here, it's a reduction of $700,000 from 2016 and 2017. Key change is the GIS team, the professional mapping team that provides you all the maps that you see during City Council. They serve every department in the city, and since they serve every department in the city, it made more sense to realign them with central services. So you're going to see our budget go down $700,000. You're naturally going to see central services go up $700,000 to make that realignment and reorganization. Okay. Street maintenance is the other side of really highways and streets, and the key role is to maximize the pavement life. One of the key aspects of getting the IMS updated roadway information was it showed that the existing pavement management system we were using kept us on track, but they did recommend that we spend more. And so in 2016, we're going to positively affect about 680 blocks of roads. In 2017, that's going to increase up to 840. And the breakdown of those respective treatments is shown on that slide. Slide on the left is a picture of microsurface. We did over 400 blocks of that this year. And the slide on the right is a new paved street, second lift. This picture just shows more active street maintenance activities. We pothole patch year round. Techcrete, we do this work when it's 40 and rising. We do it in-house, but we also outsource that work as well. And street sweeping, we sweep the streets 3 times a year. It's critical to keep all that debris out of our storm drainage systems. We're always looking for ways to optimize our resources. One of the things we just recently changed to be able to sweep more efficiently is the first sweep that we do in the year, we run 2 sweepers in tandem. So one sweeps at the center line, the other sweeps at the curb line like you see there. But that's after the first sweep, and that's usually the heaviest sweep for the year. Second sweep, a lot of that debris is just in the curb. And so we're able to take 2 sweepers and have them just hit the curb. So ultimately we can sweep a neighborhood now in half the time. And so nice upgrade to the resource that streets brought forward. Snow removal is a major effort that happens in this area with our climate. We've already had a very active year this year. There's over 3,000 lane miles to address. We have someone at the street division from November to March. If we get any amount of snow throughout the course of the evening, we have a small crew that's available. If we don't get snow any given night, they're usually hauling leaves from leaf drop-offs to the landfill throughout the course of the night, so we can keep them busy. But if we get a quick shot of freezing rain, we've got people at the street division to immediately address some of those bridge decks. When we go into a snow alert and we ultimately plow out the neighborhoods, which happens typically any given year, 4 to 6 times, it's 100 city employees from multiple departments. They go on 12-hour shifts until the work is complete. The assets are 45 motor graders, 45 sanders, 25 contractor graders, and then we run 38 snow gates. All All right, a breakdown of the budget, you're going to see that there's been a reduction in snow removal and an increase in street maintenance. This is just a true realignment of our actual costs. You can imagine that winter never always starts on October 30th. There are years where winter might start by mid-December, and so we continue to do that street maintenance activity through mid-December. Just our history tells us that in working with Shauna Nelson, our finance analyst, the realignment is a realignment of true cost for each of those programs. So these two work hand in hand. There are some years where the snow comes early, and we stop street maintenance and immediately go into snow removal activities. There are times when winter doesn't start till Christmas, and it just allows us to work longer in street maintenance. But these two work hand in hand. There is a overall increase in the streets budget by $100,000. All right, now the next most visible piece of your capital program that's in your book is the investment into streets. We have 8 key programs that organize our projects. So like the top one, asphalt street rehabilitation, that's a program. And then inside, that's where we bid the crack sealing, the microsurfacing, the mill and overlay. Same thing with concrete pavement restoration, the next one. That's where we'll buy the Techcrete out of. That's where we'll do the partial depth concrete panel repair and a number of other strategies, all the way down to accessibility improvements. The foundation of how we select and prioritize has always come from a pavement management system. We've always used Hansen, and we did a lot of self-inspection, and then we put that information in. You well know that we hired a company this last year to come in, drive all the streets, and then provide us a report. That report will be available on the city website by the end of the month to provide all that detail that we're wrapping up that study. Very happy to see that our streets rated at a 70 when the national average is between a 65 and a 60 and a 65. The targets nationally are to have your backlog, which are your poor, very poor streets that score under 40, under 12%. Ours are at 4%. The other side of it is to make sure that you have at least 15% of your streets are in excellent shape. Ours are at 20%. And so we got a really good baseline to start our prioritization. I think we all have talked extensively that as you look at the life curve of pavement, that over a very short period of time, if you can spend $1, you can reset that pavement life curve and do a very good job of maximizing pavement life. And so that's what our program does, and that's what reinforced the work that the team has been doing for years. All right, our major projects, the real visible projects, the ones that, as we say, change people's commutes, are listed on the sheet. I won't read those through to you because we do have a picture of each of those to show you. First one being Louise Avenue. This will be a flagship project next year. We're going to go into Louise Avenue between 41st and 49th. We'll not only do a full reconstruction, but we'll also do a capacity expansion. You'll see additional lanes to better manage and handle that expected traffic. Arrowhead Parkway, this is a project that the DOT asked us to take the lead on. They provided us the funding for this. So we'll essentially start where we left off at Sycamore and Arrowhead Parkway on the west side, and then we'll traverse east toward Veterans Parkway. This will be a key project to improve the ride and add capacity and ADA facilities on the east side. We put this slide in here to just highlight the work that the DOT is doing. The governor's office has committed to get us connected to I-90 with Veterans Parkway by 2019. This is the next project that will be let from Maple Street up to Rice Street. They're in the midst of final right-of-way negotiations. Once that work is done, they'll let this project, another significant transportation project, to really support the regional growth on the east side of the city. Another flagship project that we'll have next year is 69th and Western. Just a few years ago, if you remember, we went into 57th and Western and added dual left turn lanes in each direction, right turn lanes, significantly added capacity. We'll be doing the same thing now at 69th and Western. and then we'll be going north and south and east and west to provide that additional capacity. And some of that pavement out there is tired, so it's time to get rehabilitated. There's a lot of growth down in this southeast area. There's a new Harrisburg Elementary School down near South 69th Street and Sycamore Avenue. We've recently done 2 projects on both those streets, and so this would be just a simple collection or a connector with probably a rural section road. Rural section road, we call it just paving the gravel, providing a hard surface, dust control, and a smooth ride. Minimal investment to support the growth and development in the area. Marion Road to the north. Marion Road is the road that supports Foundation Park. This year, we are doing the grading, we're doing the storm sewer work, we're doing the water main extension, the fabric and gravel, and then we'll let this road sit through the winter, let it go through a freeze-thaw cycle. Next year, then we'll come back and we'll let a surfacing package to put the curb and gutter and the pavement in. Okay. 85th Street's very similar to 69th and Southeastern. Good connector on this one between Cliff Avenue and Minnesota Avenue. Gets a fair amount of traffic. It's a gravel surface road today. We'll minimize our investment by just putting in a rural section road, but ultimately create a good connector so people can avoid parts of either 57th Street or 69th Street. Phillips Avenue, we always have a focus in downtown. This last year it was Indiana Avenue. Prior year it was Franklin Avenue. We kicked off the ribbon cutting yesterday of Main Avenue Diet. Our focus next year will be 1 block of Phillips Avenue between 9th and 8th. Bring that streetscape theme forward, but also do a full reconstruction of the utilities. Our goal is to also complete the majority of the Main Avenue Diet next year. And we'll also do a maintenance project that keeps up on all the streetscape assets that we've built downtown over time. Some of those are as minor as removing some old planters. Some of them are painting, railing, things of that nature. So much more to come. All right, we did want to just give you a quick snapshot of ADA investment over the last 5 years. We've removed over 1,400 vertical barriers to make us more ADA accessible. Wes Phillips, our principal street engineer, really takes the lead on this work and does an excellent job. We've got, the city now is 97% barrier free, but we still have some work to do. And so each year we do a significant amount of ADA barrier removal. We'll give you a snapshot of 2 different situations that we often find. We can have a situation that's shown on the left where you'll have a good street, the pavement's in good shape, it's clear that pavement's going to serve that neighborhood for a number of years to come, but we don't want to wait any longer to remove that vertical barrier. So this year we have 73 corners that fit that criteria that are being removed, and they'll be brought up with the new ADA ramps. The one on the right-hand side, the street is tired, the ramps are a vertical barrier, so we'll do a complete concrete rehabilitation in something like that along with the pavement. So there we'll have about 85 barriers upgraded to serve accessibility requirements. All right, storm drainage fund. This is what we talked about as a special revenue fund. This really comes in from platting fees and the fee that you pay on your property taxes each year. Its mission is to safely convey urban runoff to the Big Sioux River and to also lead the effort in improving water quality in the Big Sioux River. We've kicked off what we call the Mayor's Water Summit 4 years ago, and that involves over 80 municipalities, 80 mayors that really, from a municipality standpoint, have the opportunity to take the lead to improve the watershed of the Big Sioux River. How this fund is broke down is it's got a budget of $17.7 million. The majority of these dollars that get spent out of this fund is in capital, and we're excited to bring forward some of the largest drainage projects that we've done in the last 10 years forward. We'll start next year to improve and bring some relief to respective property owners on the west side of Sioux Falls. This capital plan really has a few different key components. Drainage improvements is more or less categorized that if you have land and you're expanding in town, you'll pay a platting fee. We take those platting fees to go out and buy land and then ultimately build large regional ponds. We would prefer to have one large pond as opposed to several small ponds. Much more efficient for the developer and much more efficient for the city. And so that's an active program. With our growth and development, it's key to embrace that regional aspect and minimize costs on both sides. Flood control improvements, we're still investing into the levee system. I know we've certainly kicked off that we're completed with the major project with the Corps, but we still have some of those pipes that go through the levee downstream of Morels as we leave the city that need to be rehabilitated. We intend to bid that project later this year. Non-point source, we talked about the efforts that the DENR allows us to reduce our interest that we pay them by 1% and take that value of dollars and invest it into the watershed with compensating farmers to not graze their cattle between April and September. We work with farmers on manure management plans, just do a number of strategies to really enhance the water quality of the Big Sur River. And then we highlighted one of the projects that we're going to kick off, this Terry Avenue and 43rd Street. This is kind of the central part of this area, and we've got a slide to further discuss. This is a result of good cooperation between the neighborhood and the city, extensive study. We call this the Colville Avenue area. Councilor Erpenbach was heavily involved when we were out doing this analysis, doing multiple public meetings. And essentially we had an area that's west of Augustana, its main campus, just north of their ball fields, that even with what we'd say a moderate rain event would inundate some homes in that area time and time again. And so we looked at different alternatives, whether it's putting more pipe in the ground, trying to do more upstream, and they're just based on this, how steep this particular watershed was. There wasn't an alternative that was a better fit than just to go in and start asking for voluntary buyouts, creating more green space, creating more area for this rain to percolate in. And we wrapped up the study in 2011. At the time we asked, is there anyone that would like to voluntarily talk to the city and sell your house in this particular area, really from 33rd up to 28th on the west side of Colville Avenue. At the time, it was a lot of information to these property owners. I think we had a really good dialogue at numerous public meetings, but they just weren't ready. Last May, we got our first call. A lady was ready to move and asked if we were still interested in buying her house. Andy and his team stepped forward, got an appraisal. We did get that transaction completed. And then just throughout the course of the year, and then especially after the August event last year, got a number of calls. We've closed on 9 properties, and just this week we'll actually start the demolition of those 9 properties. We'll fill in the basements with sand to enhance the permeability of that area. And then just over time, as we capture more homes that are willing to sell voluntarily, then if it makes sense, we'll develop a detention pond so we can hold and then slowly release. But you'll see some changes. The picture on the left, that's 3 houses that were raised earlier this year. We graded it, seeded it, and in some cases can be some nice green space that came into some mature areas. Okay, this is an outline of what a drainage study looks like. You look at if rain hits this area in yellow, where does it go? Ultimately, this area drains from the west to the east. We've got to get this water efficiently over to the I-29 ditches. But if you look down in that subset, the yellow is just that small area from Marion Road over to I-29. There's a drainage basin that extends significantly back to the west. And so the first phase of this will be to develop some underground storage at Marion Park, very similar to what we did at Edison. That's a key project that we want to get going next fall, ultimately complete in 2018, and then we'll do another phase as we get the stormwater over to I-29. This will be the largest stormwater project we've done in the last 10 years. All right, enterprise funds. Enterprise funds are organized with user fees, are funded with user fees. Just to give you a quick summary, this is a cost of service based analysis that we do for all the utilities. We use long-term complex rate models. So in your book is printed a 5-year plan. The utilities have at least a 10-year plan that's in their rate models. In some cases, they go out beyond 10 years because we do master plans that go out beyond 10 years. So we have a good long-range look at what those capital investments need to be. But just for what's printed in the book, you'll see what the next 5 years are. We have proactive capital plans so we can deliver reliable utilities. We're heavily regulated by the state and the federal agencies, and the council supported adopting rates for the utilities that we requested for 2017, 18, and 19. Not all utilities had a rate increase. All right, the investment for 2017 in the enterprise funds is $99.3 million. Is broke down accordingly. Water reclamation has the largest portion because just like the large sewer project you guys seen, we're still heavily investing into the wastewater system. It's a highly corrosive environment, and we still have work to do. So that's where you see the major investment. Water is next, and then respectively with sanitary landfill and electric light. All right, let's get started with electric light. Electric light has a defined territory for the new counselors. Electricity, whether it's Excel, whether it's Sioux Valley, they all have a very defined territory, just like this utility has a very defined territory. The uniqueness of having a municipal electric utility is then you have access to the low-cost green power that's generated on the Missouri River at the dams. If you don't have a municipal electricity organization or a nonprofit like a rural, you can't access that power, and then you're buying power off the market. So what we always share is that one of our top customers is the water plant, and so everyone in the city enjoys good, stable, low-cost energy rates. When you're treating water, essentially you're buying chemicals, you have people, and then you have electricity. And so those are the three main components to treat water, and you have good, stable rates because of this utility. This utility has no debt, has a proactive capital plan. We do want to highlight a good cooperative program that's taken place with police and planning, along with neighborhood associations to reduce crime in neighborhoods. There'll be neighborhoods that come forward that say we would like to have more light. There's dark areas. Can you come in and do an evaluation? Sometimes it's the alleys. Sometimes it's the main streets. The light team provided just what's happened in the last 3 years to supplement light in 3 different neighborhoods. Garfield had 62 additional lights placed. Whittier had 126 lights placed, and the arena area had 16 lights placed. Just the feedback you get from the neighborhoods, certainly a greater sense of security, more light, less loitering, and a great collaboration between the neighborhoods and multiple departments. The LED pilot project's been a real successful pilot project that the light team brought forward. They did 5 last year, deployed them, and then asked the public for their feedback. The results were very positive on the type of light and how the retrofits went. And so throughout the course of the calendar year, they've kept track of the kilowatt hours on these pilot projects, and they've collectively saved about 46.5% energy usage. So we've made the decision to move forward with all new light installations, and there's over 19,000 street lights in the city. All new light installations will be LED going forward. We're having great talks with the DOT for them to consider that as well. Light department budget is $8.9 million. This is a reduction of $479,000 from last year. Again, that's closely working with our financial advisor, that it's just a recognition of that we'll buy less power to ultimately sell to our customers next year based on actual results. And so that's where I see a a small decrease. Capital, this utility has over 92 miles of circuits that it delivers power to its customers, so we have circuit improvements planned. The center picture shows those meter sockets. That's how utilities measure the amount of kilowatt hours that you use. It's time for us to make an upgrade into automatic meter reading technology, so we've been interviewing providers. One of the things that we have right now, very inefficient, is that if we have a move-in or a move-out situation, we have to send a lineman out to actually make that change at the meter socket. Or if we have someone not pay their bill, we have to send someone out and do it manually. All modern utilities now can actually do that remotely through the billing cashiers. And so that's what we'll be upgrading to. That's a key part of our plan. And then these electrical systems are mechanical. They will break, and so you always have to plan for some unforeseen electrical system replacement. All right, landfill. Landfill always has a number of things to share. Its role is to provide sound disposal of municipal solid waste and construction and demolition debris. Over 900 tons of waste comes through the front gate every day, or about 280,000 tons a year. The landfill gas partnership that we have with Payout generates almost $2 million in revenue each year, where we used to just harvest that gas and burn it off. And so we've been delivering Payout landfill gas since 2009. It's been a great partnership. And then our recycling efforts have ultimately extended the life of the landfill by 20 years. We highlighted a couple of pictures here. The first one is a compactor, and so when you think about landfills, the most important thing, once it actually gets to the landfill, the more you can compress that waste, the more dense you can get it, the more you can get into one space. And so in recent history, we've been using these large units that are shown on the left, but some new technologies, some new steel wheels, some new vibration technologies come out with a smaller unit that actually does densification better. Saved us on an initial purchase of about $360,000, and then ultimately used about half the fuel. So a great win. The landfill staff did this pilot, satisfied with the pilot, and then ultimately moved forward with a smaller machine. So always looking for opportunities to control our costs. The landfill, again, serves 5 counties, Lake, Lincoln, McCook, Minnehaha, and Turner County. Serves a population of 256,000 people. Landfill budget's $9.5 million. This utility is also free of debt. It has a change in budget, reduction from last year of $338,000. And there's just a collection of minor changes based on the size of this budget to make up that difference. But a very well-run utility. We have just a couple things to highlight on their capital plan. And so we have, as you bury waste, you have to manage the leachate. That's the black water that's in a landfill. And then you also have to manage the gas. So we can continue to harvest that gas, dry it, compress it, and then send it to Payout. So you'll always have that project in your capital plan. Land acquisition, we're always in the market for additional buffer land at the landfill to set it up for generations to come. And then building improvements. We've shown a picture here. We've talked about this extensively over the years. We're still evaluating our best method, but we know that there's characteristics that come in the waste, whether it's in the construction demolition debris or in the MSW that can be reused, potentially reused as a fuel. And so over the course of 2016 and part of 2017, we're going to further evaluate that and ultimately come back to you with a plan. Technology's changed, so it's allowed us to broaden our scope of what we originally were thinking about doing. And then just interesting point, some of these grinders that we use at the landfill, when you look at Project Nice, and you think about when a couch goes in the back of a truck, or if a piece of plywood goes in the back of a truck and it gets hauled to a landfill, we were interested to see if we ground that material somewhere closer to town, what we could reduce that volume by and ultimately reduce our trucking by. And once we actually send it through the grinders, we can reduce that volume by about 7 to 1. And so if we can get that grinder somewhere closer to town doing Project Nice, we can significantly cut our trucking resources down. Oh, sorry, this is a little bit fast. Water is our next utility that we'll talk about. 2 pictures, really, the inside of a well, and then the other is, you can see that broken piece that came out of the side, actively managing our distribution system. This utility is set up to ensure a sound water fund to meet the needs of today and tomorrow, have a safe and secure water system. We'll always respond to emergencies. Our next focus is really to invest in our source water. Councilor Rolfing has always asked, we have Lewis and Clark, what's next? Let's make sure we're positioned. So I've got some feedback to share with you today on steps that we're taking. Okay, first I want to just highlight a program that the water team brought forward. Earlier this year, there was a lot of national press about lead services, and really wasn't as much about the lead services, it was about the chemistry of the water. But there are cities across the country that have tens of thousands of lead services still delivering water to customers. You can be proud that for about the last 25 years, every time there is a reconstruction or any level of street improvement done in the city, those lead services have been removed. But the water team was interested to know how many do we have left, and then what would it ultimately take to go lead-free. And so they earlier this year did a survey, went into particular houses that they thought may or may not be updated. They found that we had 240 lines from the main to essentially the sidewalk that still were. They immediately then created a crew. We sent 2 people to Lansing, Michigan that have been doing thousands of these over the course of many years, wanted to find out some of their tips and tricks, brought them back, enhanced some of them. The water team now does 2 of these a day. Since they completed the survey, they've done about 106 of the upgrades. They'll do another 80 this year. We expect to be lead-free in Sioux Falls by mid-2017. The next thing is on our source water. We do have Lewis and Clark. They're a fantastic partner. It was one of the best investments that this community has made. Really established a long-term water supply for us with 28 additional million gallons a day water that we can tap into from the Missouri River. This is a picture of just how you see the Big Sur River meanders on the right-hand side. We brought in a high-tech company to team with the City of Sioux Falls and USGS to map the geology that exists below ground. And then they use several different radio frequencies to then understand what that geology is and where the most water-bearing soils are. And then what they can do with USGS over the course of the next 24 months, they'll calibrate this model, and then they'll start to model it with successive years of drought to tell us in a very good fashion where to put our next wells. And so on the outside of our plan, we have 2 more wells, but we're waiting for this data to really help us inform us on that decision. The other thing that we're doing, Counselor, is the header line that brings in all the water from the wells. We have 55 wells that brings in water, has some bottlenecks, so we're doing a dynamic model to understand where are those bottlenecks, and then in the coming capital plans, we'll start to remove those bottlenecks so we can harvest more water and ultimately deliver it. The water budget is $34.7 million, broken down accordingly from personnel, operating capital, and debt. This utility has not taken on any additional debt since 2011 and does not have any debt in its current capital plan. Very remarkable from that standpoint that most water utilities across the country are not in this position. So we are to a point where if those curves that you see during our rate analysis, if we finish the year above some of those reserve targets, we're going to look for opportunities to retire debt even earlier. Picture of really what this team has been focused on. They've studied the system. We've got some water mains that exist out there that are about 120 years old. We've set a goal to have all of our water mains under 90 years old. And so we've significantly increased the capital plan to upgrade water mains where we have a break history first. And so this just gives you two pictures of what that looks like. This is an example where it was asked earlier this year, does the water fund ever pay for a portion of the street? And this is a situation where it would, because to get to the water, you physically have to remove a section of the street. And then ultimately when you backfill it, you have to restore it. This is when the water team is out in advance of the street team. The water main may be at a point where we can't wait for this street to degrade. That street just visually looks good, but we've got to get this water main up to standard. So that's a situation where water funds would pay for a portion of street rehabilitation. Okay. Now water reclamation. This is just a great picture from the top of that methane gas ball out there to give you a perspective of the plant. Again, this is to ensure the fund meets the needs of today and tomorrow, provide uninterrupted wastewater service, and maximize our sustainability opportunities. One of the just notable facts is that before we invested in the right equipment and the right technology and did additional training on the teams, we would routinely have 40 to 60 sewer backups a year. And with a system that has almost 900 miles of collection mains, that's going to happen with roots growing in, offset joints, a number of things that can get in those pipes. Grease can settle out, but we've bought the right equipment. We've got those mains on a cleaning cycle, and now it's routine for us to only see about 6 to 10 backups a year, with over 52,000 customers. Okay, budget for this team is at $46.2 million. The item that will change the most on this is capital. So in any given year, we could be bringing forward a significant project, and then the next year, it may be more of what we'd call an off year. And then that's why we tap into the state revolving fund, low interest dollars to take advantage of those dollars, but then smooth the effect to our customers. This utility is also very solidly positioned for the future. Just to give you a couple pictures of some capital that's happening at the plant. We talked about the water mains in the field. We're also doing a significant amount of rehabilitation of the sanitary sewer mains out in the field, lining them, finding offset joints, sealing up manholes. These are primary digesters that the current covers are. It's a very caustic environment. They've outlived their useful life. They've essentially, the concrete that holds these digesters is in good shape, but those covers are in need of replacement. So this is a picture of what one of those looks like. We do need to add some additional equalization down by the street department. So as big flows come through, we can hold that flow back and ultimately avoid a permit violation. And then this is a picture of a new engine generator that we take that methane gas that gets generated off the digesters, and then we actually generate about 30% of the electricity to run the plant. We've got additional energy recovery components in the capital plan going forward. We wanted to give you a picture of this is a very common thing that the storm drainage team, that the sanitary team does. The teams will go out and they'll camera the lines. That comes back into a technician, and that technician evaluates. They can review those lines tapes at about 8 times the normal speed, so they can quickly take a review and then identify. If you see the picture kind of in the middle, that whole bottom of that pipe has been broken out. So they'll flag that. They'll know exactly where they're at based on where the camera walks in. They develop a plan set, and then that'll go out in the next repair project to get it repaired and bring it up to standard. We recently had just a fantastic opportunity right before the air show. An admiral gets to go to they pick about 15 different towns for Navy Week to go into a city that doesn't have a significant Navy presence, to just educate and recruit. This gentleman, he's actually from Northwest Iowa. He's in charge. He's a very similar role in Public Works, but he's in charge of over 80 naval bases, so they're all like small communities, and about 20 Marine bases. So he has about 100 of these like small communities that they deal with, from sewer, drainage, facilities. And when he came to Sioux Falls, he asked for a tour to meet some of the Public Works teams and see some of the technology that we're using. So one of the 4 things that we highlighted was, we said, let's let you drive one of the cameras down the sewer line. And so he's sitting there with Doug Dykstra. You can see it kind of looks like, that game controller that he's driving the camera with. And then City Clerk Tom Greco gave us the idea, with he being in the Army, that, such a huge rivalry about Navy and Army. And so we had this sign made and put it at the end of the sewer, at the other end of the manhole. So when he actually drove the camera down there, it made his day. That was his picture on his face when that actually took place. So we have a little bit of fun in Public Works, too, when we can. And then, too, we want to truly thank you for taking the 3 hours the other day. We looked at a number of projects. This is a notable project. We likely won't see a pipe of this diameter in Sioux Falls anytime, at least in the near term, especially in sanitary sewer. It is the backbone, and we appreciate the time you took that day to really go out and see it firsthand, the size and scope of these projects. Last division is fleet. It's an internal service fund, so the other partners pay into this. We are in the midst of, we've completed a fleet organizational study. Morgan Jackson's here. He's our new fleet manager. We're in the midst now of implementing a state-of-the-art asset management software solution to actually best manage all the fleet. We're centralizing fleet now across the city, where this year we'll bring in the parks mechanics and the fire mechanics into fleet. And then we also operate 4 fueling sites. I thought it would be interesting for you to know that beyond the city of Sioux Falls, a number of people utilize the fueling sites. Great Plains Zoo, Sioux Area Metro, Juvenile Court Center. There's about 5 divisions of the street department, or of the school district. Siouxland Museum, Civil Defense, Minnehaha County Sheriffs, and Minnehaha County Facilities all take advantage of these 4 fueling sites that are in the city. Fleet budget is $10 million. The heavy piece of here is the capital. This is where you buy the equipment to replace it, and that's the driver of this budget. And here we're at the end with questions. We just wanted to highlight too, when you see our logo, we developed that a number of years ago. One of the foundations that we strive for is every decision that we make, we like to improve the quality of life for the customers in the Sioux Falls and in the region. And so that logo shows you that that's a pathway to a better quality of life. So when you see that on the trucks, that's what it means. We're here to answer your questions that you have.
Okay, there might be a couple. Councilor Neisser.
I do have a number, so I'll just do a couple and then I'll defer. So the core neighborhood reconstruction program,
Yes.
it talks about reconstructing pretty much everything. So is that only done when you need to replace, let's say, water mains, or is there sometimes a street that's just so deteriorated that you're just doing the street itself?
The core neighborhood, typically will reconstruct about 20 blocks a year. And so that's when they've fallen beyond that any level of maintenance, and so that's a key project that's in the capital plan to address those types of projects.
Yeah, and so does all the curb and gutter go with it and all get replaced, or not necessarily?
Not necessarily. We just released a contract the other day. There's 3 blocks on Duluth up here by the cathedral. In that case, the curb and gutter was in good shape, but the pavements and utility settlements are not. And so that case, we're saving the majority of the concrete. But there are times where Duluth, if you drive today from 26th Street south to 29th, that was a complete reconstruction and just opened last week.
Did the people have their gutter replaced in front of their driveway in that case?
In that case, they did. Mm-hmm.
So sometimes you do and sometimes you don't?
Sometimes we do. That really drives it is if it's a reconstruction and then obviously it best fits to do that. But if it's a maintenance activity, it's been I know we've had conversations with you, Counselor, that really what drives that decision on maintenance-driven projects is the driveway is the access to the property. When they pulled the building permit, that's really the property owner's responsibility, and that's how we've operated now for probably 25 years.
So, okay, I don't know why you would ever replace it then.
What's that?
I don't know why you would ever replace it then if it's their responsibility.
Well, in some cases, it's there's economy of scale. So if you can envision now, if we go into a neighborhood for like a mill and overlay, and we'll replace 10 feet of curb here and maybe an ADA ramp, all that's really piecemeal work. We go into a reconstruction. There's efficiencies that come in where you remove it all, and then they have curb machines that can, put in 6 blocks of curb in a day. But you have to have it all removed to be able to have that kind of production. So there's just different strategies. We also obviously want to completely reset the baseline of that street if we're going in and doing a full reconstruction. So.
Okay.
Hearing no other questions?
I've got a couple.
Oh, Councilor Starr.
A little slow. One of the things, Mark, or Director Cotter, that I had a question about was under fleet. We talked a little earlier about with Sam and trying to make sure that their GPS and doing some of their scheduling. And then I was thinking about, I did a police ride along a couple of weeks ago, and there were some questions about who's on the GPS system, and then you equate that with Metro Communications and trying to pull that whole system together. Mm-hmm. Who would be on that GPS type of system that it would make sense to all be maybe more of a centralized system than it is?
Yeah, there's some great opportunities, what we call for these vehicle locator systems. We're really expecting that the new AssetWorks that we're putting in, which is the new software, will be our platform that we can add some of those aspects. Just last year, like all the new motor graders come with what we call telematics. So we can log in and we can track where all those motor graders are at in any given point during a snow season. We've got machines that we have that don't have them. And so we too want to have a comprehensive system. It's really coming down to logistics of how to most efficiently, whether it's sweep streets, if someone calls into the billing office to have their water shut off because they have an emergency, we want to be able to have someone pull up where the closest vehicle technician is. Whether we're plowing snow, there's so many opportunities. Once you get to this size of a community, that from a logistics standpoint, they make sense. So we're looking at different systems. We'd love to see a citywide system, and we'll probably really lean on Morgan Jackson with the new fleet manager and the new software to help inform us how to best tie all of us together.
It just makes sense, but I could see how it's difficult from department to department to, how much information where, and, especially with public safety, making sure. I know during the ride along there were several times where they called and asked for locations of different units that just aren't part of the system. And I don't know if that's coming from Metro side or our side, and some of the vehicles too, making sure that they're up and working and things. I could see it. It's exciting what we are able to do with the system and the information we'll be able to garner, but making sure that everybody's there. So
I agree. I think we're really going to see I'm expecting to see some breakthroughs in technology so we can have a good low-cost system that meets our needs. We don't need a lot of information. You can ask for, a new piece of equipment now, you can get everything from engine temp to oil temp to location. In many cases, just for logistics, we just need a couple of things, and so we're hoping that technology will allow us to do that, so we don't have a $40 to $50 bill per vehicle, and it just makes it more expensive to deploy.
Makes sense. May I do one more?
Yes, you may.
The other question that I had was when some of the background that we saw about the landfill accepting poultry carcasses and some things. Is that an opportunity? Is that something that a revenue generator at some point as we look into the regional economic development that we're doing with a large poultry facility, but possibly with other type of animal units?
Right. Well, I think our foundation to that, Counselor, was first the state veterinarian approached us and said, if more confinements located in the service area of the 5 counties. We are the sanitary landfill. We are the we have the lined landfill cells. We should be able to provide that service. Des Moines landfill does. And so we're just starting to understand that. We're writing a 25-year master plan for the landfill this year. And one of the scopes of work is to help us with what's the best management practices of handling large volumes of carcasses. And so more to come on that. Dustin Hansen leads the landfill for us, but really working in cooperation with the state veterinarian, so we can be part of the solution. Whether it's a revenue generator, we'll see. So,
Thank you.
Councilor Erickson.
Thank you. Thanks. I appreciate your presentation. You have a huge budget and lots of facets and lots of arms that come out of it. So thank you. My question is in regards to when we were talking about the water. If you could just maybe help me understand if or how does the slip-up creek fit into the water strategy with, you know, we have Lewis and Clark now, we've got other wells that we're looking at, and I heard you talking about the bottleneck system to release that. So I'm just curious if that still plays into the water strategy, or where are we with that?
Well, I think that it's I think from our position today, it's a pretty low priority. It's got some inherent issues. You know, it was an idea that came out, I think, probably in the 70s time frame. Is it that far back? And so long before the idea of Lewis and Clark. And so, first of all, to be connected to the Missouri River like we are with Lewis and Clark is an absolute home run, and that's really, you know, good quality water. The inherent issue with Slip Up Creek is, if you can just imagine, it's kind of north of the water plant. You would have to actually create a dam. And then the idea was to pump water from the Big Sioux River to fill it and then hold it. And so there's not water moving. So we're really concerned about just the quality of that water and then just the inherent issues. So you're pumping it to fill the reservoir several miles. Then you're going to pump it back to the plant to treat it. And there's just some inherent issues with it. You know, water quality is probably first and foremost. Second is we have, I think, maybe 1% of the land, maybe 1 to 5% of the land that it would actually take to purchase. So we own a few parcels because at one time, I think in the 80s, that was the most viable solution. So they started to actually go out and purchase land. But our strategy today has Slip Up Creek at a very low priority. Team, any additional thoughts? Okay.
Thank you, I appreciate it.
Yeah.
So is there any plan with that land then, or is it just kind of hang on to it for, I don't want to say rainy day, but I mean, just hang on to it until it's needed, or?
Well, I think we should talk about it. Last time we brought forward, there was quite a discussion about it. But that was also probably prior to really having Lewis and Clark and seeing the consistency, the reliability of Lewis and Clark. And so just to give people a perspective, I think there's about 5 parcels up in that area. There's one that's large, like 280 acres. That would be one that I think from a community standpoint we should hold. Great outdoor experience area. Some of the other ones that are just farm fields that are scattered, there's certainly probably an opportunity on those.
Thank you.
Yeah, you're welcome.
Councilor Staley.
Well, first of all, let me say you do have, I really respect the massive amount of responsibility that you have under your jurisdiction, Mr. Cotter. I was on record before during the campaign and for many years I've been opposed to raising water rates. I've been opposed to raising sewer rates. And I think on the council we have a huge responsibility to be the overseers for the public of what's happening within the water department. Nobody else is watching over this except us. And so, and you do a great job of giving us, you know, these pieces of information. I do think moving forward that we need to have, maybe have an audit of what's happening at the water department. Greg Jameson and I talked about that several years ago, that we just to show the citizens that when we're raising these rates and dealing with these huge amounts of money, that we are really as effective in every aspect of this as we can be. One thing I wanted to ask you about, and I guess I didn't realize that we had the $7.9 million of debt in the water department, in the water budget there. How much money in the water budget or the water department do we have in the enterprise fund right now?
How much debt do we have in the water fund?
How much asset, how much is in, because you've got I was calling it a slush fund, and I know that's not, you don't like that word, but it's like a savings account. We've taken revenue in, you know.
Yeah, this
how
month,
much, wasn't it like 50 million that we had in there?
No, it's not that. It just came out in your financial report just yesterday, and so we have it. We can, just a second here.
Mark.
It's $22.5 million.
Okay, so tell me, why do we have 7.9 million in debt? I mean, how did that, why wouldn't we be like?
So that's a debt payment. Okay, so if you go to, let me get it. I think if you go to page 17 of your let me get it here. Just give me a minute, I'll take you there.
CIP book?
I was on page 85, it just said debt 7.9 million.
Yes, so, okay, on page 17 of yesterday's, of the financial report that Tracy sent out yesterday, it will show you that the amount outstanding today in the water fund, and the majority of this debt is Lewis and Clark. But the majority of the outstanding debt today is $76.4 million. Okay, here we go. Can you point to that for me? And so if you look at the, and Dean, maybe you could stay close there. So as you look at, first the column is the series, when they were issued and what the interest rates are, and then ultimately the next thing is when's the maturity date. That's when you're going to pay off those respective notes. As you add up the obligation for each of those, that's the debt payment. That's that $7 million that you're talking about.
That you had in the, so that for the year, that's what you're saying.
That's our debt payment
right.
for the year.
Right.
That's correct. Yep. And then the same thing is just below with the wastewater fund. So this picture really, from top to bottom, gives you a good sense of the community's debt, and then as it relates specifically to the water fund, the wastewater fund, that we budget for to make that debt service payment. Okay.
Okay, and then let me, and you and I discussed this earlier, but and this is maybe something I just have to learn about how, because I did talk to our budget analyst about this too. But like I was comparing the CIP books from last year and this year, and one of the things on page, if you want to follow along here, page 173 of the new book, we're talking about land acquisition. I was just wondering, if you compare it to page 175 of the one from last year, in 2019, the user fees are going from $320 in the old one. They're $320,000, and then in the new one, it jumps up to $720,000. So I'm just, those figures are not staying the same from one year to the next. So is that, and I noticed that in several different projects as I was looking, that the 2018 one has changed quite a bit.
Right.
And so that's just moving forward, things are.
No, so there's two different, there's two significant land purchases that we expect to make, and these evolve. So now with the amount of growth that's in the northwest part of the city, one of those years we've increased that fund to purchase land for probably either another ground storage reservoir or an elevated, like a tower. And then the other one in the next year is we are able to get a third connection for Lewis and Clark. and that'll be if you take 41st Street out west of town. And we'll need to buy land for a metering building and those associated appurtenances. And so, you know, this is the interaction that engineering will have with planning and our water team, and then we'll ultimately say, okay, we believe that's about the time frame based on what we expect that area to mature that we'll need that. Now, if we see growth slow, then what we'll do is we may move that out. If we see growth expand, we may have to move one of those up. And so there's some adaptability that you have with your capital plan that you need to have with a growing community like this. But those are two reasons that, you know, we've done a lot of study in the northwest part of the city with Foundation Park, Walmart, all that development that's happening up there, University Hills. And we're starting to expect that to meet the water demands, the fire demands, that in that particular area, that's the time frame where we believe we need to add another tower. Okay, so that's why you see some of that difference. We'll do a study, we'll be more informed, and then we'll place it in the capital plan where we feel it's best fits. So, team, anything else? No?
Thank you.
You're welcome.
Councilor Neisser, you had another question?
Yeah, I'll just ask about a few. So as I was comparing the 2016 to 2017 CIP books, just kind of making notations of things that changed somewhat appreciably. So land acquisition at the sanitary landfill was up a decent amount. Do you know what that was?
Yeah,
the driver was?
I think we feel like we're getting closer on a potential purchase, and so we made some adjustments there. But that's really it. If we're constantly trying to reach out to our neighbors, and if we can see an opportunity coming, we'll either add to it or we'll reduce if we feel like that is not going to happen in the short term.
Citywide water mains seemed like it was up quite a bit. How
Yeah,
about
we've really put a lot of emphasis on replacing water mains. We want to get this age of our system down from what it currently is, down closer to 90 years. For us to do that, I asked the team, do we need to spend more? They said yes, and so we've essentially doubled that program again.
So it's just being more aggressive, not the costs have gone up or anything.
That's exactly right. You're going to see a lot more water main replaced in town, give more reliable service.
Okay, and then 11002, why is the school district park siting down substantially? And I use substantially in quotes, but
yeah. So this has been a really good program. So when a new school goes in, there's usually a developer owns the land on one side and the school owns it on the other side, and normally the school and the parks go together to buy that piece of land. And so the city, we budget in our book that when there's a new school and if there's a street to build, we pay for that portion of the city's portion. So we don't see any near-term opportunity for that. That's why we reduced it. But if we see one, was probably George McGovern Middle School. Was that our last one that we did, Chad? Probably the Harrisburg School. Okay, so we just did one with Harrisburg. That one's done, so we don't have one on the near term, so that's why we've reduced that program accordingly.
okay, thank you.
Thank you. Councilor Kiley.
Thank you, Director Connors, for
You're welcome.
your extensive presentation. And yes, you do have a lot of responsibilities and you do have a very large budget. But as we were going through, I was trying to keep track of just some, and I know that I probably missed half of them. The number of areas where we have efficiencies, which are saving us hundreds of thousands, if not millions of dollars, reducing that overall budget. And just to list some of those, street maintenance, the maximizing pavement life, Tech-Crete, microsurfacing are examples. Your street sweeping, three times a year. And some people might think, well, that's a place where we could cut back, not realizing the effect that it has on our storm drainage system. The IMS study that was recently completing, which will lead to even more efficiencies. The timing of the sidewalk and curb barrier removal to coincide with street rehabilitation at that, when possible. the LED pilot projects that are in place, which I do understand that upfront cost is quite high, but the savings is even greater. The recycling efforts on part of the city and our citizens, extending the landfill life another 20 years and putting off even more land acquisition that would be necessary. The location, the one that I really found interesting, the location of grinders during Project Nice and Keep reducing the transport 7 to 1. Now that is really thinking outside of the box, and the savings there. Lead-free by mid-2017, next year. I mean, when you look at what's happened in Flint, Michigan, I mean, the savings, I don't even know how you would tabulate that. Reducing the bottlenecks in the water system to deliver more clean water effectively and efficiently. Water main replacement with major street construction projects, timing those. And then our continuing landfill gas partnerships generating $2 million annually. So I think I just wanted to take the time to recognize your efforts and the effort of all of your staff and the savings that this city realizes year in and year out. So thank you very much.
Thank you
Good
very
job.
much. This team behind me is extremely committed, and I know we're going to have the opportunity to show you some of the facilities. We've showed you the wastewater system. We've got another tour scheduled at the water team, but this is a very committed team, and we welcome any questions that you have.
Seeing no other questions, I have a couple.
Okay.
You expected a couple.
I
didn't
did.
you? On your slide number 55, you don't need to go to it, but you're going to rebuild Western and 69th and go west on 69th to where it doubles up, where it begins there by the fire station and becomes a 4-lane. When is it going to go east to Minnesota?
We're going to strive. No,
That's
we're going to.
tired.
We're going to. It is tired, Counselor. We're going to strive to get it all done next year. You know, if we have to build it in a phased approach, first will be Louise that we'll release for bid, and then we'll evaluate our available funds again when we do programs. So this will be a combination of major street reconstruction and arterial street improvements that, you know, we always try to bid by priority. And so our goal is to actually get 69th Street widened from where it, by the fire station, all the way east to Minnesota. And then the north and south piece as shown on the graphic. I just ran out of a little space in the picture.
No problem.
Yep.
Thank you. Slide number 66, and I congratulate you guys on just, and the city by just saying, okay, we got to get this done on this Koval Avenue down by Augustana there.
Amen.
And so let's make an offer to see if we can buy those. Do you see any more of those being purchased as the ones are being knocked down, or are you looking at moving any of those? Is somebody
Well, I'll
looking at
speak
that?
to the first part, and I'll have Andy probably speak to the second part. We did source community development. Many of those homes have been inundated with water, so they have water damage. They're not a good fit to be moved. Andy's has the pulse on how many other people are currently interested in selling. Andy?
Hi, Andy Berg, Environmental. We have probably a list of another 8 to 10 property owners that have expressed interest in it. We are actually going out for appraisals on, I believe, 3 or 4 that we forecasting budget for the end of the year looks like we may be able to acquire. So we've got the real estate folks doing appraisals in cooperation with those homeowners. So continuing to move forward on it. As Mark said during the presentation, really trying to hopefully acquire a whole section of a block so that we have the ability to do something more with that area as we move forward. So budgets drive a lot of it, availability to buy the homes, but we're every year towards the end of the season, just like we did last year, trying to forecast out if we have the dollars, we'd get appraisals done and make offers on those properties.
Super, super. On slide 78 with landfill, recycling, interesting statement here, recycling efforts have extended the life of landfill by 20 years. And, you know, all we do is throw stuff into a can and put it out there like we do our garbage. I mean, what else could we do? Is there something else that the city of Sioux Falls should be doing or could be doing to extend this landfill life? Because, folks, this is not a cheap project or cheap situation. The landfill is very expensive.
Yeah, no, it's probably one of the, it is, I don't want to denigrate any division. It's one of the most exciting divisions because there's still a lot of emerging technology that's happening. You know, there are, over in Europe, there are countries that are processing 90, almost 100% of the waste into a fuel. Just next to us, Minnesota, they change that waste in several cases to a fuel. And so we're looking at some different opportunities. We could look at one that takes in our household hazardous waste, or sorry, our normal just municipal solid waste, and find a way to separate out what they call the high calorics, which is the cardboard, the plastics, the papers that burn very high and are also clean, and then create what they call a refuge-derived fuel. If we took out 50% of the current stream and created a fuel with it, just imagine what that would do to the life of the landfill. And so that's really some of the tours that Dustin, Trent, and our environmental team, they're going to go on to look at some of these best practices and then guide us. We've kind of, for years, talked about everything that comes in a construction dumpster, about 70% of that is recyclable. Well, some new technologies come up. There's more opportunity. That's why we've slowed down this decision, and we're thinking bigger. So, more to come.
And one last question. Councilor Erpenbach, did you have some?
Just, I want to follow up.
You
finish, I'll follow up after you're
Okay.
done.
You promised that you would give us an idea of where the next source of water was going to come from. In that, and did you? I didn't hear where you said.
I didn't. I can tell you today we have access to 75 million gallons of water in the aquifer. Today, based on our well field and our header pipes coming in, we can probably access about half of that. And so our opportunity is we're doing a dynamic model that says, how could we, what pipes would we have to install, where would we strategically have to put the wells in, so we could get closer to our water rights, which is 75 million gallons a day. So our next water source is one that we're currently using. We just want to use it to a fuller extent. And then after that, maybe other opportunities through Lewis and Clark. So.
Okay. Councilor Erpenbach.
Thank you. Council Chair, there were just a couple of things that you said that just sparked a couple of questions that I had, so I previously hadn't planned it. I just wanted to talk, Director Cotter, a little bit more about the Colville Lake area, or the Colville lots area. That Andy's comment about the additional number of, because we bought 9 lots so far, we have some houses out already, and these 9 additional ones now, and a possible 7 or 8 more going. Can you talk about one of the big concerns that we have in that neighborhood is, number 1, affordable housing, and then number 2, the possible sort of loss of the neighborhood feel? Mm-hmm. Can you talk about what that could look like? What do you see that becoming? I mean, we're talking drainage pond, obviously, so green space, but can you talk about that a little bit more, kind of alleviate some of those worries?
Well, I think we want to be cautious too. I mean, we certainly appreciate the neighborhood feel. We all live in neighborhoods, and so we're conscious of that. I think that, you know, there's an opportunity for some of these areas to potentially redevelop. But if you look at them today, the house is here from an elevation standpoint, and the curb and gutter is here. So just, you know, as we always talk about moving stormwater, really the intakes and the pipes only capture a fraction of it. The majority of the stormwater in a major rain event flows from the sidewalk to the sidewalk down. So anytime this curb would get full, it would get into the properties, because the properties in some cases are lower than the houses. In some cases, there may be an opportunity between 33rd and 28th that we don't need all that space for a detention pond. That would be a very long linear park, or I believe that there's probably an opportunity for some redevelopment, only getting the new houses up higher. And maybe they're not basements, maybe they're slab on grade. So I think your comment is spot on, and it's a good time now with the opportunities that are in front of us just to bring community development more into the fold and help us guide us with that.
Right, and I guess that's the thing that, as you said earlier, I've been involved with this for a long time, but hadn't really ever thought about all these little houses being kind of sucked into the ground, and so I'm a little nervous about that. So I appreciate that. I know that you are cognizant of as well. Then my other response was to the council chair asking about the landfill, and you in two different statements said, one, over in Europe they're doing amazing things, and then you said in another statement, some of our staff are going to make those tours, and so I put Europe and tours together and just wanted to know, is that what we're doing, and can we go? And so.
Oh, we don't have any Europe
be
tours. No, we don't have any Europe tours. We've got vendors that are coming over from Europe to. We just had one present to us. They were from Austria. That grinder that you've seen, we've had for a number of years. Very high quality machine. So that's Comtech. They came and did a presentation to us probably 2.5 months ago. I think we're going to start regionally. We're going to see what best practices are regionally. We'd like to probably start walking and then ultimately running. And so, it may require a trip overseas, but we don't have one planned today.
Great, thanks.
Just do it before the end of our terms, please.
Okay.
No, I'm kidding. Mark, I want to say thank you for a well-done presentation. We were not cauterized this time. I'm sure we'll get that some other time. But you have a tremendous responsibility, and we can't thank you enough for the job that you and your team does. How you keep all them straight and keep moving in the same direction is beyond me, but job well done. Thank you very much.
We appreciate it. Thank you very much.
To all of you. That will bring to an end our basically our last budget hearing. We will have one next week with the county to go over the budgets that we have in common with Minnehaha and Lincoln County, or we have a meeting in Lincoln County next week. I want to remind everybody that we are going to have a working session on August 25th, 3 o'clock in the afternoon, if you have someone that you would specifically like to talk to, a department head, et cetera, to get to Jim or to David so that they can be invited and be there. Also, if you do have a question, I would suggest, if at all possible, to send it in an email form to them and maybe have it resolved before we even get there. A lot of times that can happen by an email or even a visit, and then it's taken care of. I guess that's about it. If you do have any amendments that you're thinking about, again, get to Jim and David so that they can get them prepared for the budget long before, if at all possible, so it's not all done at the last minute. David, do you have anything else that you'd like to have me add on that? Okay. Thank you all very much. This meeting is adjourned.